Hi, my name is Dr. Vincent Cesario. I've been practicing in the village of Black River for the last 30 years. A couple of years ago, I began investigating Invisalign, which has been around for a number of years, but I think in the last several years has become very cutting edge. This has become a pretty exciting way to straighten people's teeth of all ages. And many of my patients are previous wearers of traditional braces in their teens. Now in their 30s and 40s, need to have a little bit of refinement done. This is the digital scanner that we took pictures of Alex's teeth with and have formed a digital representation of what her teeth look like now. And the simulator produces an image of what we expect to find at the end of her aligner treatment through Invisalign. They see improvement along the way. They're excited about what they're doing. It becomes an easy habit, and ultimately they end up with very nice straight teeth. So when we start the case with Alex, we're going to have trays 1 through 27 already made, and she'll be responsible for changing the trays week in, week out. The process is enhanced to some degree by small buttons that are tooth colored that we place on the teeth at the very first appointment. This is our patient Alex, the before and after that we can show her family if they want to, and get her ready for her big day, and we're excited to be part of it. Is that everything's lined up pretty well, but subtle changes take place over time. In Alex's case, we see two very distinct central incisors. This is the before case, because these little lateral incisors have turned a bit and have rotated somewhat, and have maybe even intruded to some extent. In the final, we see that these laterals are the same height, or more consistent with the canine and the central incisor. That subtle move, that subtle turn, that slight twist, if you will, makes such a visible difference in the smile. The average patient will take roughly 6 to 10 months, and the final presentation can be tweaked beforehand and should be. So time frame is shorter, but the retention time I think is better complied with by the patient, and is an easier thing to do for the patient once they've gotten through the first couple of aligners and get that confidence and get that routine down. But they're so used to wearing their aligners, and they're so comfortable wearing them. Many feel like, I hate to use the word naked, but feel naked without them because they've worn the aligner so much they feel secure in them. Employees, my dental assistants in particular, are full bore on this. They take part in every facet of what we do with our patients.